dear moderators, dear colleagues. First, I want to thank this meeting scientific committee to have selected this abstract about n-hexyl cyanoacrylate for the closure of mésentériques defect during Roux-en-Y gastric bypass. My disclosure for the presentation. So closing the defect in Roux-en-Y gastric bypass is recommended to reduce internal hernia occurrence, as has been proved by the Goebbels meta-analysis published in British Journal of Surgery in 2015, and also by Stenberg multicenter randomized trial published in The Lancet in 2016. But the conclusion of the author was the optimal technique of closure remained to be determined. So you can use metallic clip, which seems to be less effective than absorbable suture, or non-absorbable suture, who is the main technique used actually to close the defect. But sometimes it's difficult, and at the end of the procedure, some surgeons renounce to perform it. Sometimes you have complications like hematoma in the mesentery, and also it's time-consuming, and we all of us saw reopening of the closure at the end of the weight loss. So that's why we thought, what about using glue to perform the defect closure? So we select the n-hexyl cyanoacrylate. It is a synthetic glue with strong adhesive properties, very much better than biological glue. Its time of polymerization is about 40 seconds, and after 1 minute there is no other adhesion. So that's another difference with biological glue, in which you can have adhesion of the bowel and of greater momentum, as shown in animal models. The n-hexyl has got a long lateral chain, longer than n-butyl or n-methyl cyanoacrylate, and it gives it specific properties like an excellent biocompatibility, because there is a very slow absorption of this glue, and also a good flexibility of the glue layer, and a few exothermic reactions during polymerization, never over 2 degrees Celsius, to avoid risk of burning tissue during polymerization. We choose it also because there is still intraperitoneal clinical application, as you can see, for sleeve gastrectomy or rectopexy to fix a mesh and close the peritoneum. So we perform an observational study of a prospective data collection with retrospective analysis. The study conducted on 426 patients with a laparoscopic Roux-en-Y gastric bypass, anticolic, antigastric, performing our metabolic surgery department from February 2018 to March 2021. The follow-up was at 1, 3, 6, 12, and 24 months. This is our surgical technique. At the end of the gastrojejunostomy, we remove the alimentary limb to the left part of the patient. Then we lift the greater mentum and lift the transverse column in the upper part of abdomen, as to make a grow or a furrow in the infracolic part of the Peterson space between the mesocolon and the mesentery. And then we apply the glue using the proper laparoscopic applicator, and we let some drops fall in the groove. Has to perform a very thin layer of glue. We always wait for 1 minute before releasing exposure to avoid sticking of other tissue or other organ to the layer glue. And as you saw, we do exactly the same to close the mesenteric defect on the left video. This is an example of the aspect of the defect closure at 14 months after Roux-en-Y gastric bypass in a patient in which we perform cholecystectomy. As you can see, we have perfect closure with this white scar tissue in place of the glue. So what about our results? The characteristic of the 426 patients, mean age was 44 years old. Mostly patients are female, 78.2%. The mean BMI was 44 kilograms per meter square, and we have an excellent follow-up until 6 months, because 100% of patient was followed up at 6 months, a little decrease at 12 months, and at 24 months, 19.8% was follow-up. There were no mortality in this group of patients at 24 months. What about complication? I report the complication equal or over 3A in the Clavian-Dean complication. On the left tables, you can see the detail of the short-term complication with a rate of 1.8%. In the left tables, the detail of the complication of the long-term complication with a rate of 7.54%. There were no complications due to the use of the synthetic glue, no internal hernia described in this group of patients, and no kinking was reported. But to be honest, I have to say, we have our first internal hernia last month in a patient in which we performed surgery 15 months ago, but it was not in the data of the study. So, in conclusion, we can say that n-hexyl cyanoacrylate for the closure of mesenteric defect during Roux-en-Y gastric bypass is feasible and safe. If you use it, please respect the rules. Just apply thin layer of glue, 1 milliliter is enough to close both defects, and wait 1 minute to avoid sticking of other tissue to the layer glue. But of course, multi-center randomized studies are necessary to confirm this result and to evaluate the best technique to close defect in Roux-en-Y gastric bypass. Thank you for your attention.